Dental cleaning, what to expect during a routine checkup. Good oral health is vital to overall health. One of the most important aspects of a healthy dental routine is the regular appointments with your dentist. The routine visits typically include the need for a dental cleansing that is an essential element of preventive treatment. In this short video, we'll discuss the things to expect from the routine cleaning of your teeth and the importance of it to your dental health. The initial step of the routine cleaning of your teeth involves a thorough exam performed by a dentist. The dentist will look for indications of tooth decay, gum disease, or any additional oral health concerns. Your dentist can also perform an X-ray to take a closer view of your teeth and jawbone. The initial examination is crucial to identify any issues in the early stages and then determining the most effective treatment plan. Following the exam, the dental hygienist then starts the process of cleaning. The process typically involves the removal of plaque and tartar off the teeth with special instruments. Plaque is a film made up of bacteria which forms on teeth. It can cause gum disease if it is not eliminated frequently. Tartar, on contrary, is a hardened plaque that is only removed using the aid of a professional dentist. In the course of cleansing, the hygienist also polishes your teeth in order to get rid of any surface stains and smooth them. This improves not just your appearance but also make them less vulnerable to the buildup of plaque. Hygienists can also brush your teeth in order to eliminate any plaque or food particles which may have accumulated between your teeth. After the cleansing is completed, after which the dentist can use a treatment with fluoride to aid in strengthening the enamel and prevent tooth decay. The mineral fluoride aids in remineralizing the teeth and also prevent the development of decay. This is particularly important for adults and children who have a greater chance of developing cavities. Alongside, the cleaning dental professional may conduct a periodontal examination to assess the condition of the gums. The procedure involves measuring the thickness of the spaces between gums and teeth to look for the presence of indications of gum diseases. If there is gum disease, the dentist might recommend further treatments to treat the problem and avoid any further harm to gums and the supporting dental structures. In general, regular dental cleanings are vital to maintain healthy dental overall health. They aid in removing tartar and plaque from your teeth, reduce the risk of cavities as well as gum disease. They also ensure that your smile is looking the best it can. Regular visits also enable the dentist to spot any possible issues in the early stages and offer the correct treatments to avoid any further issues. For optimal dental health, it's advised to see the dentist to get a clean and checkup at least once annually. If you are concerned regarding your oral health or are suffering from any signs like tooth pain or bleeding gums, do not hesitate to make appointments with your dental professional. Always remember that prevention is more effective than treatment in the case of the health of your mouth. Regular dental cleanings are a crucial part of keeping your mouth healthy. If you know what to anticipate during routine dental checkups and apprehensive that you are taking good proper care of your teeth and gums, be sure to focus on your dental health by making regular appointments with your dentist and adhering to the recommendations of your dentist for proper dental hygiene. Your smile will be grateful for it.